When we talk about psychological disorders, it's easy to think of them as something rare, something that happens to other people. But they're a fundamental part of the human experience, affecting how we think, feel, and act. So what does that actually look like on a global scale? The numbers, well, they're pretty staggering. Just look at this number, 1 in 8. That's the number, according to the World Health Organization, of people right now living with a diagnosable psychological disorder. I mean, let that sink in. That's almost 1 billion people. And here's something that's really crucial to grasp. For so many, this isn't something that just shows up in adulthood. Nearly half of all cases start before the age of 14. This is something that can start early and really shape a person's entire life from the get-go. Okay, so how are we going to tackle this huge topic? We're going to break it down. We'll look at 4 major categories: anxiety, mood, and habits, and then we'll touch on sexuality and well-being. And finally, we'll talk about what the path to recovery looks like. All right, first up, anxiety disorders. And these are, by a long shot, the most common psychiatric conditions out there. We're talking about that excessive fear and worry that can just completely throw a wrench in your daily life. Just how many people? 301 million worldwide. And we have to be clear, this isn't just about feeling stressed before a big meeting. It's a persistent, often debilitating condition that needs real understanding and care. Yeah, and anxiety isn't some monolith, right? It shows up in a bunch of different ways. You've got generalized anxiety disorder, or GAD, which is like a constant background hum of worry about, well, everything. Then there's panic disorder, which brings these sudden, terrifying waves of panic. You also have social anxiety, making normal interactions feel incredibly threatening, and, of course, specific phobias tied to one particular thing.
And to see the real-world cost of this, just think about this example. You've got a bright, capable student who's so terrified of being called on in class that they just stop going. All that potential, all that ability, it gets sidelined, not because they can't do the work, but because the fear is just too much.
But here's the really important part. There's good news. There are incredibly effective treatments. You've got things like cognitive behavioral therapy, CBT, which is all about helping people rewire those destructive thought patterns. Certain medications can help rebalance brain chemistry, and even things like mindfulness can give people powerful tools to manage their symptoms. The point is, there is a clear path forward. Okay, let's shift gears to our next big category, mood disorders. Now, these aren't just your regular emotional ups and downs. We're talking about persistent disturbances that are actually a leading cause of disability across the globe. And a massive piece of that puzzle is depression. It affects 280 million people. And again, this isn't just feeling sad. It's a heavy, debilitating condition. Hopelessness, exhaustion, losing interest in everything you used to love. Then you have bipolar disorder, which is really a condition of extremes. On one side, you have manic episodes. Think euphoria, grand ideas, really risky behavior. And on the other side, you have these deep, depressive episodes, total sadness and withdrawal. So managing it is all about trying to find that balance in between. Think about this scenario, a successful professional who just stops caring. They drop their hobbies, pull away from friends, their performance at work tanks, and pretty soon they've lost their job. It shows you just how devastating that downward spiral of untreated depression can be. And what's so important here is that the treatment has to fit the disorder. It's not one size fits all. For depression, that's often a mix of antidepressants and CBT. But for bipolar disorder, you absolutely need mood stabilizers to handle those extreme swings. And for both, things like psychoeducation and having a solid routine are just game changers for long-term stability. All right, on to our third category, habit disorders. And these are all about this really powerful compulsive loop. It's a behavior that gives you this tiny bit of relief in the moment, but in the long run, it causes some serious harm. The classic example, of course, is OCD, obsessive compulsive disorder. And man, is it a vicious cycle. It starts with an obsession, right? This intrusive, unwanted thought pops into your head and creates massive anxiety. To get rid of that anxiety, you perform a compulsion, a repetitive, ritualistic behavior. The problem is, the relief is just temporary, and that just makes the whole cycle even stronger next time. And you see this same kind of compulsive loop all over the place. You see it with things like trichotillomania, that's hair pulling, or with pathological gambling, or even compulsive gaming. And of course, with substance use disorders, where that loop gets a powerful chemical boost. And the impact? It can be absolutely brutal. This example, a young adult with OCD washing their hands hundreds of times a day until their skin is literally bleeding, I mean, that just perfectly captures how a compulsion can completely hijack someone's life. It makes work, relationships, almost anything feel impossible. So, how do you break these loops? Well, it takes some very specialized therapies. For OCD, the gold standard is something called ERP, exposure and response prevention. It's all about slowly teaching your brain that if you don't do the compulsion, the terrible thing you're afraid of, it's not actually going to happen. For things like skin picking, there's habit reversal training, which helps you become aware of the habit and replace it. And for substance or activity habits, motivational interviewing is key to helping someone find their own reasons to change.
Okay, let's talk about our final category. It's a sensitive topic for sure, but a really important one: sexual disorders. These are conditions that can mess with desire, arousal, or behavior, and they often cause a ton of personal distress and can really strain our relationships.
And what's pretty striking is just how common this stuff is. I mean, this is not some rare problem. Look at this. 43% of women and 31% of men say they've experienced at least one sexual dysfunction. So just talking about it, normalizing it, that's the first step. Because just like everything else we've talked about, there are effective treatments out there. And the consequences of this stuff, they just ripple outward. Take this example. A man dealing with erectile dysfunction might start to avoid intimacy completely, just out of fear and shame. And what does that lead to? Strain in his marriage, and it can even kick off a full-blown depressive episode. It's never just a physical problem. It is always deeply emotional and relational. So when you look at all these categories, anxiety, mood, habits, a really clear picture starts to form. Yeah, these disorders are a heavy, heavy burden. But the overwhelming message here is actually one of hope. We have treatments that work. The path to getting better is there. But, and it's a big but, major hurdles like stigma and just being able to get care are still blocking the way for way too many people. And this really brings us to a powerful, critical point from our source material: prioritizing psychological care. It isn't just some nice thing to do. It's a moral and a practical imperative. The well-being of a society, its productivity, its entire future, it all depends on this. So at the end of the day, we know what works. The science is solid, the therapies are proven. The real question we're left with isn't what we do, it's how do we do it? How do we, all of us, actually tear down the walls of stigma and cost to make sure that this life-changing care gets to every single person, every single one of that 1 in 8 who needs it?